when a lady is giving birth, her body is making a decision of what type of child she wants. One of the curses of today's world is that you have medicine for everything. It's like giving a life support and life support and life support.
The world just suffers so much because people don't develop the right capabilities at the right time.
Because there's so much spent on improving longevity, but not the quality of living.
The ANH Podcast.
Welcome once again to the ANH Podcast. And today we are actually exploring a very interesting topic, a topic on health and longevity. So when we are sitting here in the 21st century, has our health really improved? Has our longevity really improved? And what is the price we may be paying for it, if it has? And how you can ensure that you have optimal health and optimal longevity. Again, a disclaimer, we are not medical doctors. We are not psychologists. We are not certified nutritionists. People who are going to give you any kind of an advice, think of all of this as education so that you can consult the appropriate specialist for taking any action. But think of this as education about understanding some of the responses from your own body that is based on the results that we have achieved in improving the well-being of so many people and how it translates directly to health and longevity. So, Harini, this is like such an interesting topic for us. And it's also one of that topic which we don't touch generally. We stay away from it because we want to be clear that we are not like doctors. But then we also help people with so many emotional capabilities. We teach them how to be in the moment. We teach them how to just be focused. We teach them how to be happier. And then we also help them clean out the noise from their unconscious signals. Like for a lot of people, when they pay attention to their own body, it's like those old radio where along with the song, you also hear so much noise that you can't really hear the melody at times. So we help them clean that thing out so the signals from the body are so clear and they can understand. And when these things happen, either they go consult a doctor about something that they didn't before, or maybe the body naturally heals, and many things happen through which people actually recover and come back to like great health. So even though it happens and people come and tell all these results, we've not necessarily or ever opened up like a program saying we'll help you recover, except for the stuff that we do once a month where Dr. Sudha actually does it. He does an exploratory session saying, let's find out what is possible. And being a medical doctor and being trained on EIT, he still doesn't commit that anything is possible. And that's why we call that as the exploratory clinic. And it happens every month. Mostly we have shied away from this topic because we are very clear, we are personal evolution artists and scientists, and what it allows us to do is help improve individuals, and that evolution in that individual is so strategic that it impacts their business, health, career, family, the impact they create, and their longevity. But today here we are talking to our audience about health and longevity. So what do you think? How do you feel?
I feel like, Antano, as much as we try to not talk about health or longevity, it's unbelievable how people hear about us. They're always knocking on our doors month on month for that explanatory clinic that you spoke about. And the kind of conditions that people come with are mostly conditions, names that you and I probably have never heard of.
Yeah.
But then they come. And what's absolutely delightful is they come for those 2 days of exploration, and by the end of those 2 days, they've gotten a significant breakthrough in their actual symptoms, which are verified by medical doctors, because we have doctors heading that within our clinic, although we don't administer medicine.
And we actually ask them to first finish all the medical tests and what the doctors have recommended before they even come. In fact, there are a lot of people who've sent back saying, it doesn't look like you met a medical doctor first, so go finish that and then come to us.
So we do, of course, take all of the necessary precautions, being absolutely obvious about the fact that we're not medical doctors. Yet, I don't think it's just now, but literally from the time we first began, like
with
10,
Kumar.
20 years, 10, 15 years ago almost.
Yes.
Is the most remarkable story, I would say, has literally changed the trajectory of what we thought was possible. In fact, I think I wouldn't be doing what I'm doing now with you if that, particular dramatic turnaround moment didn't happen.
So, what is this dramatic turnaround moment, honey? Because a lot of our audience in this podcast are actually people who may have not come to our programs and they're experiencing us for the first time. What is this dramatic turnaround moment?
Out of the blue, it's when I got that call from a friend of mine asking for a friend of hers. They reached out about this particular person, Fani Kumar, who was in the US, a young IIT graduate who just about passed out, had gotten a job in Mu Sigma, and he was working there, and he met with a really unfortunate car accident which rendered him entirely paralyzed from his neck to the rest of his body. There were just no movements, no sensations. It was a C5 fracture, partial C4, and they'd consulted several neurologists in the US, and they said that nothing is possible. And they literally shipped him back to India in an air ambulance. There he was, his life just literally came crashing overnight. And there's his friend asking me, is there anything that you can do through, all that you've learned and all that you're exploring? When Fani Kumar himself wrote to you, and when he said, can you help me become independent again? Now, he didn't say, can you help me manage? He didn't say, can you help me overcome the grief? He didn't say, is there a way, forget about this pain? He actually asked you, can you help me become independent again? Can you help me regain my movements again? When doctors have said this is medically impossible. So for me, it was just, it was like an epiphany moment to even have that question posed at us, regain movements again, which is a total medical ask. And like, we don't have doctors written on our foreheads. So how is that you're reaching out to us asking for this? In that very first session, Fani Kumar got his movements in his toes. That was where he got his movements first. And I think you would have probably met him about 4 or 5 times through those 6 months. And by then he'd gotten, like through systematic work each time, it's like the doctors couldn't believe what just happened. So you literally had to bring the doctors over and his physiotherapist and show them the movements, recognize and help them distinguish that, hey, these are not spasm, but these are controlled movements, where you would demonstrate by asking him to move his toe and it actually moved. Now, it might sound pretty dramatic to the audience, like, how did you make it happen? Like, is it some crazy voodoo, or are you like working with his mind and asking him to lift his fingers and toes? No. We did something absolutely sensory specific. I think that was my first personal experience of knowing that there is a response system in the body other than what has already been named and discovered
and
labeled, right? We are working on the set of things that could be influencing the body response to the various triggers and everything that's happening inside. Because what else can explain, say infertility in women, where clinically everything is all right. They're doing their tests. It's been years and years and they're trying and they're unable to have a child. And then they have IVFs and those IVFs fail. We've had women like this who come to us, and you know how we've even done this with like 100% money back guarantee, right? Saying, we'll do our work with you. If it doesn't work, or rather if you don't conceive and deliver a healthy baby, you can take your money back. So far, we've had a 90+% success ratio out there. I mean, I think even IVF probably has like a 30% of a success ratio. Now, how is it that we're not doing anything to do with medicine? We're not, giving them a prescription. We're not giving them any drug. We don't even touch people in any of our sessions. Then how is it possible that somebody who's been struggling to conceive for 9 years, somebody who's had 2 IVFs, if the same body is now able to conceive naturally and healthily and deliver a healthy baby? Now that's crazy. So what do we know, or what have we observed about the human body?
I think the biggest secret that we know, Harini, is that a man and a female can conceive naturally. That our bodies are capable of conception. And I'm calling it a biggest secret because I feel like we have forgotten as a society. The fact that you have so many fertility labs, you have surrogate mothers, you have medicines. And the scary part is that most people who go to IVF, and thank God for IVF, because there are so many people who benefit and they have their child. But the challenging part is those people who go for IVF, a majority of them are healthy people. They have medically everything in their favor. They have the right sperm count, they have the eggs, there's no hormonal imbalance, and yet they cannot conceive. As a person who's trying to conceive, the belief is not so strong that as a human being, I'm capable of conceiving. Get a child as a couple, when they come together intimately, they're stressed, and men have dysfunctions. The body of the lady is not relaxed. So there's this continuous workout instead of enjoying each other's company when they are intimate with each other. And during the day, there's so much stress. So all of these things, they kind of hamper the body's natural ability. Now, I heard somewhere from a doctor, someone who's doing cutting edge research, he said that the mitochondria in the body is actually capable of making decisions. They're not just powerhouses like we had learned when we were a child. And the maximum number of mitochondria in the body are in the reproductive organ of the lady. It is very evident that it's there because when a lady is giving birth, her body is making a decision of what type of child she wants. And that's how which egg and which sperm gets formed is decided. It's not random. It's not like the fastest sperm first. It's not like the one that is ahead in that
Queue.
pool. Yeah, it is more of a very calculated decision by the body based on so many factors as to what kind of climate do we live in, what kind of terrain do we live in, what kind of dangers exist, what kind of resources are available. Am I going to take care of the child myself, or will I have the support of a strong father? There's so many decisions, and the body is just choosing that it may not be the safest time to have a child for most people. So we have so many systems in the body. We have the immune system, we have the autonomous system, we have the nervous system. So the question is there a system that responds to unconscious beliefs and unconscious desires and unconscious conflicts?
Like a physical system.
Yes.
Just like there's the immune system.
Yes.
Another system that responds to beliefs, threats, unconscious
Conflicts,
perceptions.
Yes. Could it be that there's a system so powerful and capable that it can systemically alter the function of the other systems, including our immune system?
Well, doctors talk about stress all the time. Every time people go through certain lifestyle diseases, as we call it these days, they say, "Oh, this is stress induced." Now, stress is not a physical thing. It's not
there's no medical test to check for stress.
Yeah, at least not a commercially available, easily reliable. Oh, so this is your stress level, 80 or 100.
So when doctors say stress, what they most times mean is something outside of what we know in the body. And there is an overwhelming evidence from what we have observed, as well as from what happens day to day for people in the world, that there is another controller, another mechanism that is able to alter even the immune system, because a lot of times autoimmune is just the body attacking itself, and then you help people change the way they look at life, and then it autocorrects. Is there an overarching system? And I would like to call this as a systemic installation response. So installation is a change in a belief or a change in an outlook towards the world that is happening, or about yourself that's happening, or an unconscious education that's happening. So that's installation, and it's systemic because it's connected to various systems in the body, and it's holistic. It's not localized.
And there's a response that the body creates.
And when you do a systemic installation, there's a response that the body gives by altering the immune system or altering some elements of the autonomous system, and thereby there is a specific outcome that should have been there in the first place, but it wasn't. But now it's restored. So when we actually help individuals conceive, they should have conceived in the first place, but it was altered. So using systemic installation response, you restore back that ability of the body to conceive naturally.
So you're saying that this installation response actually influences at a micro cell level, and the decisions that these cells are making.
I would say so. I would say that's what it appears like. Now, obviously, this is an invitation for more research, and we ourselves have sponsored some studies, and there are ongoing tests and researches going on in this regard. And what it really does look like is the way we think, the way we believe, the things we believe, they have an impact on how our body responds.
So, I know is a way to correct health conditions positive thinking, because if it's possible that what you're thinking influences, there's a system that gets influenced by the way you think. So maybe just think positive and everything will be okay.
I think positive thinking is a very generic word. Different people mean different things when they say that. Most people, when they say positive thinking, they only mean wishful thinking. Let me give you an example of what I mean by belief. Like, there are so many people in the villages here in this country where they go to a doctor and they say, I have this problem, I have that headache, I have this, and just give me one injection, I'll be fine. And the doctor gives a placebo, gives water. And then the person goes back and comes back after 1 month saying, give me one more shot of it. And then the doctor gives, and then they're fine. The person is in fact deceived that there was actually a medication. But that created a response in them that so strong, so internal, so deep, as if there was a medicine. And they had a conviction that they have got the cure. Now that created a change in their body. That level of shift is required, and not some mere, oh, I think I'll be fine. You get the difference between, oh, I know everything will be fine, I think everything will be fine, versus, oh, I know I've got the right medicine, I'll be fine.
And that level of a change is what we can bring about with installation.
Yes. Why do you need a placebo?
That's what we've been doing with people.
Absolutely. Why do you need a deceptive way?
Tricking the mind to believe rather than just go direct, right?
Yeah, see, I don't mind using a placebo. It has saved lives. It can save lives. And a placebo is better than doing nothing. But an installation response is better than placebo, because then you can reach a wider audience, because not everybody is tricked by a placebo.
And this is an approach where you literally go direct. You communicate with that system that's responding to installations, and literally negotiate with that system, identify are there unconscious objections. That unconscious means they're consciously not aware of it. So could there be something that's going on that at a deep unconscious level there are objections in a particular way, and then we resolve it in the most ecological, safe, respectful manner. And once all of that is sorted internally, the body, being so incredibly capable, is also able to reverse, undo some of the harmful changes. And we've seen that time and again.
Yes, Harini.
With some of the work that we've done with people, they look 5 years younger, they look 10 years younger, their skin glows again. And it's like the cells are just rejuvenating, and they've aged in reverse. We've seen how skin that looks like it hasn't breathed for 20 years and suddenly, by the end of the session, where it's physically showing up in their skin color, in their energy. And so many doctors, that some of the doctors have taken some of the work that we do all the way into the ICU. We've had, distress calls even during COVID in the middle of the night from doctors in the ICU saying, even though the person is in sedation, their body is not relaxed. Just giving a drug for sedation doesn't, yes, of course, it produces certain kind of relaxation, but not the kind that is optimally required for the person to recover from this condition. Because we all know that it's not the drug that produces a result, it's how your body responds to the drug.
I often joke with doctors saying that when you give a stressed person sedations, you're just changing stress to nightmares. And the brain is still working. It's still anticipating.
The reality hasn't changed.
Yeah. And we have noticed how when doctors go and use some of these installation response, they notice that the body actually responds differently to the same medicine.
And I love how the highest number of referrals and everything comes to us from some of the most established doctors in the country. And it's not just random people. They come themselves, then they send their family members.
First.
Right? And so this is with all due credit to medicine and everything that we continue to evolve and develop, like the whatever the
Yeah, I
researchers
mean,
in the
I
world
always
are
tell people who
doing.
practice alternate medicine, I say, when they say medicine is this, medicine is that, doctors are that, I said, when your family member has a heart attack, where do you go? They look shocked at me, and I say, you go to the hospital. And I say, medicine has its place. It is the best known thing to correct an acute condition. And now they're evolving, they're getting to preventive health. How do you stop something from happening before it happens? But I think where medicine is underplayed even now is when it comes to optimizing health. And this is something we discovered during the COVID, is that right after COVID, we said, hey, most people's thinking abilities have reduced. And we were the first to say that. And 3 months later, the medical journals published that they've observed something known as brain fog.
It's also because, I know, we're right in the field all the time, where
Yeah.
the rest of the world was shut down during COVID. The medical field, of course, was on the field. They were overworking.
While the medical field was trying to save life, we were trying to look at the quality of life.
And how many people have we done?
And the life,
Yeah.
yeah.
Like we ran this for free during COVID.
Yeah.
As a business, it's like we had our own set of challenges as well during COVID, like every other business in the world. But we ran this service for free, and the entire ANH community pitched in. We trained so many people and who were available on call. We used to get so many calls from people who were seeking COVID support, starting with emotional, and then,
All the
like,
way going to installation response that tries to improve their ability to fight the virus itself.
and we've had doctors from the hospitals
Yeah.
physically verify clinical changes
Right
immediately after
the-
we've
the
performed
procedure.
some of these.
So that's very effective, Harini. But I think where I really like what we do is in the optimizing health aspect of it, because I think that's a gray area, that's a black box. The optimizing health is where someone is not sick, but they can be better.
Yeah.
Because I think not having sickness and health is not the same thing. Because not having sickness should be like the minimum standard of health. And we saw this during COVID, and especially the first month after COVID, we said a lot of people have not gotten back to their prime energy, because in our heads, we're always comparing people when we see them months, like snapshots. As evolution artists, we have snapshots of people run across time, and we look at it and we say, oh, why is this person not as much healthy as they were like 2 months ago? And then over a year later is when the scientific world confirmed that there's something called as prolonged COVID. Only reason we could do this, and we published this on YouTube as well, and we said we even gave people mechanisms to know, how do you know you've gotten back to optimal health or not? So what happens when someone falls sick is, let's say this is their energy level, they go down here. And when they recover and they've come only so much, their comparison is to how sick they were and how they are now. They forget reference of how they were when they were optimal. So most times people don't even have a mechanism to know that after COVID, their health, their performance, their energy, everything has dropped. And they don't even know that it has dropped. And we actually came up with mechanisms to notice that. We came up with mechanisms to correct that. And as we always tell people, everything we think we know, we think of it as our best guess until it works. So if you think, hey, post COVID you're tired, so now let's try this procedure, and then we talk to them as a human and their unconscious processes, and we educate and we correct certain things, and then the energy comes back. We're like, oh, this is right,
And it's working.
and it's working.
And
So-
we've
so
noticed
the-
this with
yeah.
COVID, as well as these days, even with this more viral attacks that are happening. It may not be COVID, but there's some unknown virus kind of a thing that people these days are seeming to suffer with more.
Yeah.
And there's like a total depletion in their energy and vitality, and the tendency to fall sick.
And
more
when they come back,
often.
they're not just as healthy. The COVID was just one example of how not being sick in itself is not full health. When you are healthy, there are other parameters to know, and it can be optimal. And also, when people take a blood test, there's a range.
Yeah.
Now, being in the range means you're not sick. But again, there's an optimal value to everything. I want to discuss a little more in today's episode about what does optimal health look like. Is it being thin, your ability to run like a marathon? What is, like, for a day-to-day person, what is real health? And also, health and longevity are two different things. Someone may be very healthy, and someone may live long even being unhealthy. And I think that's one of the curses of today's world is that you have medicine for everything. So, it's like not literally, but it's like giving a life support and life support and life
I mean,
support.
the worst is what happens to like really old people, and when they're put in a ventilator and they're made to struggle and suffer and die a painful death.
Yeah, but imagine if someone is living like that with medication and compromised quality of life, they may have longevity, but not necessarily
Health.
good health. I don't know. Like if people are asked to choose, you can live 80 years or full health, or 90 years where health is okay, but medical support is available. I'm sure everybody would choose 80 with like full health. We don't know when we are making the choices where we start compromising our health. Yes, some of these things help us sustain life and live longer, but it's not necessarily improving our health. So while longevity is good, how do you also look at getting back to full health?
And the predictive intelligence to arrive there, another very significant contribution of excellence installation technology in the world, because most times people are innocent, they don't recognize the long term consequence of the daily decisions and the long term consequence of their current set of capabilities, the long term consequence of not evolving as fast as they should be, the long term consequence of not having some of the unconscious priorities in place. And the worst is, all of this is literally like hidden under the carpet. Most people don't know this. Creating evolution artists with excellence installation, bringing people into the awareness of all of this and the capability to go and change the trajectory when the predictive intelligence with regard to health is off.
That's very important because your business affects your health. Your career affects your health. Your relationship affects your health. Your family affects your health. Your personal genius affects your health. Everything is actually connected to everything else. Aspiring evolution artists, people, the viewers or the audience of this episode can take from this is every single thing is again connected back to your health. And how healthy you are is going to be connected back to everything else. A lot of people feel drained by the end of the day in a good way because they worked hard. They did something they loved. And the others feel drained by the end of the day because they hated what they did. Now, when you just look at it just casually, they're both drained, but different effects on the body. That one person is going to sleep well, the body is going to restore. The other person is going to be contemplating life. At the time when the body is supposed to restore its cells, it's stressed and anxious. From a very simplistic view, it looks like, oh, both of them worked hard and they're tired. No, one person was satisfied. The other person was doubtful about his future. And they both have different effect on the body. The other person, while he was working, the brain produced endorphins because he's enjoying what he's doing. So although he's tired by the end of the day, his cells did not go through the burnout that the other person endured. So not only is he repairing better, not only is he forming new cells better, he also had lesser burnout. When you recognize that everything is connected to everything else, that is the only way you can improve your health.
Deep down, I think all humans recognize that business or their career and their growth out there is important. All the financial gains and everything is important. Their relationships are important. The health is important. Them evolving their personal genius is important. Them creating the kind of impact that they should be creating, that is important. But it's like when people tend to make some decision, which is, it's like you're hitting the striker, but then when it's not landing where it's supposed to and it kind of messes it a little bit, it's like almost there's like a shake up that's happening, but it's happening so mild, just like the earth is rotating, but we don't recognize that it's rotating.
Yeah, actually, apparently the earth is actually tilted.
Yeah, but we don't feel like we're tilted, right? So it's like it's happening. They're making some decision that they're doing it in the best of intention, but let's say it's not turning out well enough. There is like a shake up, but it's so mild, like the tiniest of tremors that you don't even feel. But now when that continues to happen, it's kind of disrupting the ecology of integrated life outcomes. And when that continues to happen, it takes them on a trajectory that they did not design consciously, but is leading them there anyway. And for me, just developing the wisdom of knowing, and for your body to tell you when it's kind of getting disrupted a bit, and you have to, like, it brings your attention out there. Now, these are what I call superior capabilities, like what we call superior capabilities, right? Like, for me, it's just fascinating how even some of the world's greatest challenges can be simply solved by having accurate predictive intelligence and developing the superior capabilities ahead of time. Because I feel like the world just suffers so much because people don't develop the right capabilities at the right time.
I think scientists are so hard working on making humans live for 120 years.
Imagine that without predictive intelligence, they'll just be more depressed, miserable people at 120, struggling without money
And without good health.
and without good.
So now instead of letting a person die peacefully from 80, you let him live till 120, but he has to take this injection every day. The ideal outcome would be 120 years of full life, because history points towards humans actually being gifted, and even scriptures talk about the lifespan of a human being about 120 years. Science is saying it's a software problem, not a hardware problem. that our bodies have the mechanism. And this is another, why should science say this? Isn't this common sense? Like, a man and a woman can come together and conceive. And yet most people have forgotten that. And in the same way, the other secret, which shouldn't be a secret, is that our body has infinite ability to heal itself. In fact, most of the cells in our body are not what we were born with. And they didn't even exist 10 years ago. They have been regenerated. So it shouldn't be a surprise that if the regeneration isn't happening, it isn't a hardware issue. It isn't because we don't have the ingredients. The reason scientists say what they say is because a lot of the mammals and other things that live longer than humans apparently have the same physical composition in terms of what makes up the organs and stuff. So they're like, it's not looking like it's a hardware problem, that it more likely is a software issue. And
So if the body does have infinite capabilities to heal itself,
yeah.
then what configuration
yeah.
triggers such holistic healing? What we've done through the work is we've seen that through some of the work that we're doing, we're able to systematically, predictably, with thorough validation, able to see that we're able to trigger the body into
We are
producing
exploring where,
the
in which
response.
situations. As I said, these are exploratory, so we don't know if it works all the time. What we do
With what
know,
we've done so far, and with the, we're learning with every case that we do, is, we're also in a safe space here because we're not administering a drug. We're not
administering a drug, and we're just saying, is it possible to activate a different response from the body?
Yeah.
And can this response influence the other systems in the body? And that's a great space to be in. So what they call as a software response is what we call as an installation response, because we don't necessarily see the software and hardware being separate from
each other.
And they're like more integrally connected. And I also feel like if 120 years is possible, it should be made possible with absolute good health. That is where the entire scientific world has turned a blind eye, because there's so much spent on improving longevity, but not the quality of living. If you can walk, but you're going to live till 120, it's very different. Like, and I'm saying walking, I'm not talking about using clutches or anything. Like, imagine the person walks 10 steps and they have to pant, or they have to take something so that their lungs are strengthened. The health care is leading too. And like one of our close associate, Dr. Sudha, always says that in the medical field, we're so focused on saving lives that we forget that it's also important how they live after that.
Quality of life.
And the quality of life. And my recommendation to our viewers right now is that invest in your health by actually correcting the things in your business, family, and relationships. And when that happens and your health is regained, you'll find that you'll grow in your business and career and your relationships as well way, 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 way more holistically. If you have good health, you have good energy, you're happy around your children, you're happy around your spouse. You could pay more attention to what conversations you're having. You can be stimulating, and that in turn will pay into your health. So it's like a connected system, and when it's rolling, it's rolling. If it isn't rolling, get it back on track, because all said and done, it's having a impact on your health.
The ANH Podcast.